Mark Sklar on KIOW. It's time for House Calls with Hancock County Health System. Your health, our care, a lasting partnership. Today, we're talking bike safety for July with Lillie. Kelly is the nurse practitioner providing treatment and care at Hancock County Memorial Hospital's emergency room and inpatient unit. Kelly, thanks for joining us.
Yes, and thank you, Mark.
Since you work in the emergency room, are there specific injuries you see more often during the summer months?
Absolutely. And one that comes to my mind this week, and especially with RAGBRAI going on, is bicycle injuries. And every year about 300,000 children and adults are seen in emergency rooms across the country with injuries related to these bike accidents, the most serious cases involving injuries to the head and the brain.
Kelly, do you have any safety suggestions for our bike riders?
Certainly. An easy one is to wear a bike helmet every time you go for a ride, even if it's just around the block. Injuries happen as often close to home as they do 20 miles away on a bike trail or country road.
What kind of bike helmet do you recommend wearing?
Styles and colors, people can get to fit their own personalities, but it's a good idea to make sure you have an approved helmet that meets safety standards. Those helmets that meet those safety standards will have a label on them. They will either have the initials CPSC or SNELL or ASTM, and those stickers are on them if they do meet the standards. And before getting on your bike, it's always good to make sure that your helmet fits properly. And the chin straps should be tight enough so that when you open your mouth wide, you can feel the top of the helmet pull down on your head a bit, and the helmet should also cover your forehead. When you ride, the helmet shouldn't slide or bounce around on your head, but it should fit firmly.
Any other safety tips for bicyclists that you would like to share?
Well, riders always need to wear bright-colored clothes and put reflectors on their bike and on their clothing, too, to make sure that they're more easily seen in the traffic. Riders also need to be on the right side of the road and travel the same direction as traffic does. Bikes are just like vehicles, and riders must obey traffic rules, so if there's a stop sign, it needs to be stopped at, and riders need to also remember to use hand signals as well. Children under age 10 should ride on a sidewalk and avoid being in the streets. Another big one is to make sure that your pant legs, any backpacks, straps, or shoelaces aren't where they can be caught in your bike chain. Or riding on a bike that's the right size for you is also very important. And one way to measure that is when you stop, both of your feet should be able to be flat on the ground. And there should be about 1 to 3 inches of space between you and the top bar on the bike. If listeners would like more health information, I invite them to visit our website at www.trusthchs.com. Our healthy living tools are on the website, including System Navigator, health risk assessments, and a drug interactions database.
Kelly, thank you for joining us, and thank you for the information. We appreciate it.
Certainly.
Lillie is nurse practitioner providing treatment and care at Hancock County Memorial Hospital in the emergency room and inpatient unit. And this has been House Calls with Hancock County Health System. Your health, our care, a lasting partnership. On behalf of Lillie, I'm Mark Sklar on KIOW.